So for supraclavicular interscalene, make sure that the hand should go towards the knee. This way the space opens up. Okay, this is one of the tips. And you can have a wedge in between the two scapula to make the plexus rise. So continuing back, what Dr. Divan showed you, all the roots. You must be wondering, he is speaking the same language, I am also talking in the same language. Why so? Is there some syllabus given to us? The answer is big yes. In Regional Anesthesia Pain Medicine Journal, the entire structures which need to be identified for each and every block have been given. So there are 2 articles, I would request all of you to go through them. For interscalene, it's crystal clear that you have to identify C5, C6, 7, 8, T1. For brachial plexus also it has been clearly defined. So that is why we are speaking one unified language. Some people might show you less, some people might show you more. But the idea to impress upon you is that we should talk in that language. Everybody does supraclavicular, you are getting good results. But now the demonstration will tell you exactly where the trunks and the divisions are located and where you need to deposit. Is it clear? And we can cut down the volume also. So again scanning, starting from ultrasound machine. So gain थोड़ा सा ठीक करो ताकि वहाँ screen पे सामने ठीक आए. Yes. So subclavian artery is sitting on the pleura. So what do I need to do? Into the thorax. This maneuver will help you. The entire plexus is situated like this. Can you appreciate? Okay. So I will keep going up. As I keep going up, gain थोड़ा सा बड़ा हो भाई लोगों. Yes. So can you identify C7? कोई doubt है? मनीषा point करते रहेंगे. C7, left hand of the screen is medial, my dear friends. Okay. On the medial side, can you switch on the color, please? Can you see the vasculature? What is that? The vertebral artery and the vein. In the landmark-based era, last used to happen. Why? The vertebral artery and vein is very close by located. So accidentally we might puncture. Can we go back on the 2D mode?
Yes, sir. So this is C7 level, no?
Yeah, C7.
So this is the vertebral artery. This one is the vertebral artery.
Yeah, vertebral artery and vein both are seen.
Both are seen, and where is the root, sir? C7 root? Yeah, this one is the root.
Yeah. So as we go up, 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 can you see the classical C6?
Yeah. The C6 dipping into the transverse process of the C6 transverse process. And this is the Cassagni's tubercle, the anterior tubercle of the C6, which is the Cassagni's tubercle.
Okay, as I go more up, C5 is diving. Can you appreciate the C5 diving?
Yes, sir.
So now once I see C5 diving towards its intervertebral foramen, then the job is to go back to the clavicle. So C5 coming out, can everybody appreciate? Okay. In this case, C5 is split. Can you appreciate the C5 getting split?
Yeah, the C5 is split and the C6 is also split on the beginning. Yeah.
C5, C6 split, can you appreciate? Everyone? Okay. Then C7 would come out.
Yeah.
Okay. Now observe, can you decrease the depth please? Now keep your eyes on this. Depth decrease karo. Decrease. Yes. C5 and C6 will fuse together to form the superior trunk. Can you appreciate they fusing together?
Yes,
so
sir.
this is the site for giving your proximal superior trunk block through for the shoulder surgeries. As I move down, my dear friends, can you appreciate it is splitting into SPA? Can you appreciate splitting into 3 where Dr. Manish is pointing out? The SPA arrangement from lateral to medial which Dr. Divan was showing was lateral is suprascapular nerve, mid one is the posterior division and the medial most is the anterior division. The muscle on top of it is omohyoid. As I keep going slowly towards clavicle, my dear friends, suprascapular will dive towards the underneath the omohyoid. Can you see it has begun to dive? It has begun to dive and it would come somewhere close to this. So if I perform the block at this level, this would become the anterior approach to suprascapular nerve, which is known as the SOS block. Can you see a vessel coming in between? What is that vessel? dorsal scapular artery, transverse cervical artery is seen at the level of ventral rami in the interscalene groove. This represents the dorsal scapular artery. So initially when I was going up, high in the neck, what was happening? I was not able to visualize this vessel. So the key to success is to move slowly. I move back to the clavicle and again I ask him to increase the depth. So the entire brachial plexus is situated. Now we are not able to see the C8T1. I'll try my level best. All times we are not able to appreciate, but it's located just in that pocket. So vessel can be appreciated by all. Dorsal scapular. I go up.
So can you increase the depth a little bit so that...
C7 again, can you appreciate the C7?
Yes, sir, we can appreciate C7.
Okay, as I go up, C6 appreciated by everyone?
Yeah.
C5, okay? So going back, C5, C6. My dear friends, coming out.
We can also see the phrenic cell.
Yes.
Very beautifully.
So can you decrease the depth? और डिक्रीज करो, और डिक्रीज करते जाओ, और करो, बस रुक जाओ. My dear friends, concentrate C5, C6. This is anterior scalene muscle, this is medial scalene muscle. Can you see this hypoechoic nodule? This represents the phrenic nerve originating from C3, 4, 5. As I descend down the neck, this phrenic nerve will be moving medially like this. Okay? Keep observing this. Dr. Manish is going to trace it for you. Can you observe this? Can you observe, my dear friends? So phrenic nerve is situated so close to interscalene groove. If I deposit 15 to 20 mLs and if it's a high pressure injection, the drug is going to spill over and cause a direct blockade of the phrenic nerve. So always make sure that you have low pressure injections, thereby meaning inject very slowly, slow increments, and do not inject more than 8 to 10 mLs of the drug. Is it clear? As I go more towards the clavicle, you can see the phrenic nerve. Can you see the phrenic nerve? Everybody can appreciate or not? So let me tell you, it won't be visible in each and every case, and this machine is too good. Okay? So we are able to see, its size is 0.76 millimeters. It is now going to get into the groove between the trachea and the esophagus. I go back up, up, up. Can you appreciate? Can you appreciate for yourself? Can you appreciate? Can you appreciate? Again, diving towards C5. Another nerve which I would like you to focus your attention, in the substance of the middle scalene, you are seeing some white hyperechoic smudges. These could very well represent the dorsal scapular and the long thoracic nerve. How do I identify? With surety, you can use a nerve stimulator. So when you are blocking at the level of C5, C6 coalescing and coming like this, the white hyperechoic smudges are in the middle. So thereby avoiding injury to the dorsal scapular and long thoracic nerve, which are situated in the middle of the substance of the middle scalene. So is this concept clear about the neural elements identification above the clavicle? Now you can easily give your supraclavicular brachial plexus as well as interscalene brachial plexus, and the refined version, that is the superior trunk block. Superior trunk is formed by the fusion of C5, C6. Is it clear? So the proximal